Hello and welcome to our channel, where we share useful information about health and wellness. In today's video, we are going to talk about a serious topic that affects millions of people around the world: colon cancer. Colon cancer is the third most common type of cancer and the second leading cause of cancer death in the United States. It can affect anyone, regardless of age, gender, or lifestyle. But the good news is that colon cancer can be prevented and treated if detected early. That's why it's important to know the early warning signs of colon cancer and not ignore them. In this video, we will tell you what colon cancer is, what causes it, what are the risk factors, and most importantly, what are the symptoms that you should pay attention to. So stay tuned and don't forget to like and subscribe to our channel for more health tips. 1. What is colon cancer and what causes it? Colon cancer is a type of cancer that starts in the large intestine, also known as the colon. The colon is the last part of the digestive tract, where water and nutrients are absorbed from food and waste is eliminated from the body. Colon cancer usually begins as small growths called polyps that form on the inner lining of the colon. Some polyps are harmless, but others can become cancerous over time. The exact cause of colon cancer is not known, but some factors may increase the risk of developing it. These include age. Colon cancer is more common in people over 50 years old, but it can also affect younger people. Family history. Having a close relative who had colon cancer or polyps increases your risk. Genetic disorders. Some inherited conditions, such as Lynch syndrome or familial adenomatous polyposis, FAP, can cause multiple polyps and increase the risk of colon cancer. Diet. Eating a lot of red meat, processed meat, or animal fat, and not enough fruits, vegetables, and fiber, may increase the risk of colon cancer. Lifestyle. Smoking, drinking alcohol, being overweight or obese, and being physically inactive may also increase the risk of colon cancer. 2. What are the early warning signs of colon cancer? Colon cancer usually does not cause any signs or symptoms in the early stages. That's why screening tests, such as colonoscopy or stool tests, are recommended for people over 50 years old or those with high risk factors. Screening tests can help find polyps before they become cancerous or detect colon cancer at an early stage when it is easier to treat. However, some people may experience some symptoms that could indicate colon cancer. These include a change in bowel habits, such as more frequent diarrhea or constipation, or a change in the consistency or shape of your stool. Rectal bleeding or blood in your stool. This can be bright red or dark in color. Sometimes blood may not be visible but can be detected by a stool test. Abdominal pain or discomfort, such as cramps, gas, bloating, or pressure. A feeling that your bowel does not empty completely after a bowel movement. Unexplained weight loss or loss of appetite. Weakness or fatigue. These symptoms can also be caused by other conditions, such as hemorrhoids, irritable bowel syndrome, IBS, infections, or inflammatory bowel disease, IBD. But if you have any of these symptoms for more than a few weeks or if they get worse over time, you should see your doctor as soon as possible. 3. How is colon cancer diagnosed and treated? If you have any symptoms that suggest colon cancer or if you have a positive screening test result, your doctor will perform further tests to confirm the diagnosis and determine the stage of the disease. These tests may include a physical exam and medical history to check for any signs of colon cancer and assess your risk factors. A blood test to check for anemia or other abnormalities that may indicate colon cancer. A colonoscopy to examine the inside of your colon and remove any polyps for biopsy. A biopsy to examine a sample of tissue under a microscope and look for cancer cells. Imaging tests such as CT scan, MRI scan, PET scan, or ultrasound to see if the cancer has spread to other organs. The treatment for colon cancer depends on the stage of the disease, your overall health, and your preferences. The main treatment options are surgery to remove part or all of your colon and nearby lymph nodes. This is usually done by laparoscopy or open surgery. Chemotherapy to kill any remaining cancer cells or prevent them from growing or spreading. This is usually given as pills or injections. Targeted therapy to block specific molecules that are involved in the growth or spread of cancer cells. This is usually given as pills or injections along with chemotherapy. Radiation therapy to destroy cancer cells or shrink tumors using high-energy rays. This is usually given before or after surgery or in combination with chemotherapy. Immunotherapy to boost your immune system's ability to fight cancer cells. This is usually given as injections. The treatment may cause some side effects, such as nausea, vomiting, hair loss, fatigue, infection, or bleeding. Your doctor will monitor your condition and help you manage any side effects. Colon cancer is a serious disease that can affect anyone, but it can be prevented and treated if detected early. That's why it's important to know the early warning signs of colon cancer and not ignore them. If you have any of these symptoms, see your doctor as soon as possible. And if you are over 50 years old or have high risk factors, get screened regularly for colon cancer. Remember, early detection can save your life. We hope you found this video helpful and informative. If you did, please give it a thumbs up and share it with your friends and family. And don't forget to subscribe to our channel for more health tips and videos. Thank you for watching and stay healthy.